name's Dr. Topouzian and you're watching Ask Dr. T. Today's question is, do I have fibromyalgia or chronic fatigue syndrome? Well, why do you ask? Well, because I have all these symptoms. I'm depressed, I've got fatigue, poor sleep, my body aches all over the place, I'm apathetic, there's no zest for life, my libido's gone, I'm bloated after I eat, I've got constipation, stomach pains, cold hands and feet. Okay, I get it. You got a lot of symptoms. So the question is, do you have fibromyalgia and or chronic fatigue syndrome? Well, to us, those are just words, and it keys us into the fact that we have to peel back those words, and we have to look underneath and see what the underlying cause is. And for most people, the basic underlying causes are either a hormone imbalance, including thyroid, menopausal hormones for women or testosterone in men, and your adrenal hormones, your stress hormones. These are all things that have to be tested. And I'm sure that many of you have had your thyroid tested in the past, and you're saying to yourself, you know, I've had my thyroid tested I don't know how many times, and every time the doc says it came back normal. Well, unfortunately, what's happening in those situations probably is that they're testing a TSH, thyroid stimulating hormone, which is a screening test. It's just not enough. There's about 8 to 10 different thyroid tests that you need to do to actually see if you have a thyroid problem. Many people have Hashimoto's, which is an autoimmune disease. Some people have thyroid resistance, where you're actually making the wrong kind of thyroid hormone and it's blocking your good hormones. Menopausal hormones, female hormones, they have to be tested. Your adrenal glands, your hormones need to be tested. And then if they come back abnormal, they need to be treated. How do you treat them? We usually use bioidentical hormones, which we get from compounding pharmacies. If you don't know what a compounding pharmacy is, they are an old-style apothecary, if you will, that makes up prescriptions or hormones from scratch. They're bioidentical or natural, if you will, so that your body doesn't know the difference between the natural hormones and what your body would naturally make. They are not synthetic. And most people feel quite better when you replace their hormone levels. There are other causes for fibromyalgia and chronic fatigue, and usually it's not just one problem. Usually people have numerous things going on at once. And again, one of those things is we look for different infectious agents. Yes, some type of smoldering chronic infection that's been going on for God knows how long. And these can be either bacteria, viral, a parasite, molds, and these are tested through different blood work, or sometimes we end up doing stool testing on patients. And depending on what we find, we treat them either with prescription antibiotics, antifungals, antivirals, but we also use different IV therapies here, intravenous therapies, to enhance or build your immune system so that you can kill off these bugs by themselves. Other causes, environmental toxins. We look for heavy metals, mercury, arsenic, lead, that can cause symptoms of fibromyalgia and chronic fatigue syndrome. We also look for different autoimmune conditions, including Hashimoto's, lupus, MS, rheumatoid arthritis. If somebody has one of the markers that shows that they have autoimmunity, that also means that they either have a underlying infection or some type of food sensitivity, which we also check, and or environmental toxins, or all the above. And you have to treat these things. You can't treat these things if you don't know that they're there. So one of the most important things is testing for all of these different conditions. We also look for different coagulation disorders, which is when your blood's thick. For example, think of your capillaries or your blood system as a colander, is what you use in the kitchen. And then if you took that colander and if you took a piece of saran wrap and you put it on the inside, okay, what would happen if you tried to strain something through that? Nothing would get through. That's kind of what happens in your blood vessels. There's a very microscopic layer of saran wrap, if you will, that's inside your capillaries and veins and arteries, and it doesn't allow the nutrients to get through to the different tissues in your body. What happens then? Well, you have pain, you have fatigue. It depends on where it's affecting your body the worst. One very important thing that so many people have, and it's malabsorption or poor absorption of their nutrients. So the first thing you might say to yourself is, okay, I don't know, I'm gaining weight. I guess I don't have malabsorption. I'm absorbing everything. Well, just think of it this way. If you're not making stomach acid, for example, let's say you're on one of those medications for heartburn or GERD. Stomach acid, if you don't have it, you don't absorb your minerals like calcium and magnesium. You don't absorb your amino acids, your proteins. You don't absorb your B vitamins, okay? So all of these things your body needs to produce energy, okay? And if you're not producing energy, what happens? Well, you have fatigue, you have brain fog, muscle aches and pains, cold hands and feet, etc. The whole list, the whole gamut that you get with chronic fatigue syndrome, fibromyalgia. But you absorb carbs all day long because you don't need acid to absorb carb. So you have all these symptoms and you're gaining weight. And you don't have to be on one of those medications for that to happen. A lot of people are predisposed to this because of their diet over the decades. If you've eaten a standard American diet, which is cooked food for years, decades, eventually your stomach, it tires out, it fatigues. It can't keep making the amount of acid and digestive enzymes that your body needs to break that food down. So what happens is one day it says, hey, I can't do this anymore. I'm done. And so you stop making as much stomach acid as you do, and so then you stop absorbing these different nutrients. It's pretty easy to test for these things, and it's pretty easy to treat, but you have to treat it. And while you're treating it, what we also do is intravenous or IV therapies to bypass the stomach, if you will, and give patients what they need, the different minerals, the B vitamins that your body's just craving for. So in a nutshell, there's a lot of different things that you look for when you're treating or looking for a cause for fibromyalgia and chronic fatigue syndrome. Now, I'm not some well-renowned lecturer that goes around the country. I'm not published in well-known journals. I'll probably never get nominated for the Nobel Peace Prize for medical advancement. But we see patients all day long with the same symptoms you're having, and most patients get better. I'm going to say 80% of the patients will improve. The other 20%, we just have to work harder with them. But generally, if you've been, let's say you've been ill for 5 years, it takes probably 1 month per year to actually get you better. On average, most patients after their second to third visit are feeling 20% better. After about their fourth to sixth visit, they're feeling about 50% better. Okay? In a nutshell, that's it. You don't need to be on antipsychotics. You don't need to be on these different medications. You need to find the underlying cause of the problem. Okay? Any questions? Well, if you do have questions, you can email me at askdrt@gmail.com. That's askdrt@gmail.com. Or you can go to our website, www.ask4, drt.com. My name's Dr. Kerry Topouzian, and you've been watching Ask Dr. T.